Good morning and good afternoon. My name is Josh Schreiner, and I am the Chief Product Officer at Health EZ. Thank you for attending this exclusive webinar on our new pharmacy solution, EZrx. We're excited today to walk you through how this program works, how it can help your employer customers save significantly on their pharmacy services, and we'll make sure to leave about 10 minutes for any questions you all may have related to the product, but thank you for attending. So for the last 12-ish months, we have been working behind the scenes to continue to improve upon the pharmacy solutions that we bring to market. One of the very obvious challenges that our employers are facing is we continue to see vertical consolidation of the supply chain. So if you take a look at who owns pharmacy benefit managers, you'll commonly see large insurance companies such as Blue Cross, Aetna, Cigna, Humana, United Healthcare. And what they have done is purchase the entire supply chain related to pharmacy costs. And what have we gotten in return? Higher prices, not lower prices. It's making an impact on competition. And our goal here at Health EZ is to find new and innovative ways to help reduce pharmacy spend for level-funded and self-funded employers. So over the last several years, we have brought to market 4 different pharmacy benefit solutions as preferred PBMs. All of these solutions have a specific niche based on an employer's desire for cost containment versus member abrasion. And what it has resulted in, based on customers who have purchased one of those pharmacy solutions, based on 2023 pharmacy data, is that our customers who purchase that service from us are paying on average 29% less than a typical industry average pharmacy plan. So in 2023, the average pharmacy gross costs, so these are the costs before a plan receives any rebates to lower their pharmacy spend, was averaged at $135 per member per month. Health EZ customers who purchased one of our 4 PBM solutions spent in the same plan year $96 per member per month before rebates. So a 29% reduction in gross spend. You might be asking, what are some of the reasons for the reduced spend for these customers? And they range from great financial terms, annual audit and market check provisions, the ability to carve out specialty drugs when an employer is interested in finding alternative sourcing options. And when you bundle all of those together, our customers are doing exceedingly well compared to market averages. So we're super excited to talk to you today about EZrx and how this can reduce pharmacy spend by up to 50% over industry averages. And one of the big components of this program is we are focused on aligning the interests of the plan sponsor with finding the lowest net cost medication. And so one of the big differentiators as part of EZrx that is new is we are actually carving out and taking away the clinical review or prior authorization from the PBM. So we will be reviewing all medications that are $1,000 per fill for clinical review, and will no longer allow the pharmacy benefit manager to make the determination on those reviews. Industry averages show these prior authorizations are approved between 80 to 85%. And our goal is not to deny medications. Our goal is to leverage the clinical review process to identify what is the lowest cost medication or what is the lowest cost sourcing opportunity for that medication. The goal here is not to maximize rebates, it's to find the lowest net cost, which sometimes could involve rebates being the lowest net cost. But our focus, and what we'll get to here in the upcoming slides, are 7 different ways that we can bring down the price of prescription drugs for an employer. So, our focus on bridging the member experience while also delivering cost containment means that we have bundled together a whole host of solutions that are overseen by our care advocacy. So many of you who leverage Health EZ today on the medical side will know that we have a fantastic advocacy and navigation service that focuses on helping members schedule appointments, look for the cost of care, get second opinions, deal with any member issues with a provider, really white glove service to our member base. So now we are expanding that to our pharmacy solution through EZrx. One thing that's really important to point out is Health EZ is not starting a PBM. We do not want to be a PBM. We are agnostic on the PBM. Our goal is to take our pharmacy benefit solution and plug it in with a number of PBMs so that we can lower the pharmacy costs on our employer groups by up to 50%. So our first partnership will be with Prime Therapeutics, where we will deploy the following solutions to help reduce costs. The first is we will continue to offer patient assistance programs. Health EZ was on the bleeding edge in 2018, bringing these types of solutions to market. We will be adding or continuing to offer copay maximizer programs. So this is where members get some sort of a subsidy from the drug manufacturer to buy down their deductible or out of pocket. Our copay max program focuses on providing a win-win, so lowering the costs for the plan while also lowering the costs for the employer. Some of the new solutions we will be bringing to market are an international mail solution. So those will come from tier 1 countries, be in English packaging, and will be offered to members with a $0 cost share. We will also be offering a therapeutic equivalent program. So this is a brand new solution, and part of the reason why it's so important for us to manage the clinical review and prior authorization process. As part of that, we will be able to identify, based on the medication that is prescribed, if there is a less expensive therapeutic equivalent within the same drug class, or determine if that medication is eligible for one of the other savings levers, such as patient assistance, international mail, etc. We also, as part of that therapeutic equivalent program, we will be targeting biosimilar conversion. So over the last year and a half, there's been a lot of talk in the market about Humira and the now 16 different biosimilars that are on the market. We're extremely excited to announce that we will be adding Stelara's biosimilar to this program. So not only will we be able to target Humira biosimilar, we'll be able to target Stelara and switching it to a biosimilar. All of this will be done in coordination with the member's physician, making sure that the medication is clinically appropriate. Again, our goal here is not to stop people from getting the meds that they need. Our goal here is to find the lowest cost for these medications. A couple of data points on that biosimilar program. Humira's list price today before rebates is anywhere from about $8,000 per month, all the way to as high as $16,000 for a 1 month supply. The biosimilar is as low as $1,000 a month, with the top price being $2,000 a month. So dramatic plan savings. Rebates cannot compete on the pricing of these biosimilars. The rebates will never be able to get that low, and it provides free medication to the member while also providing the plan with significant savings. Stelara will have more information on the exact biosimilar list price. But just to give you some ranges, we see Stelara anywhere from $18,000 to $25,000 a month, depending on the PBM. The biosimilar right now is looking to be somewhere between $5,000 to $7,000 a month. So huge savings for employers, huge savings for members by not having to pay for these medications. And this is going to be the future of how we lower specialty drug costs for employers by making sure that these biosimilars are available to our members even when the PBMs aren't making the formulary change to cover these biosimilars. That's what's really important about EZrx. We're aligning the interests of the plan with the lowest net cost, and we're not beholden to formularies that are dictated by rebates. Um, this program will have a whole pre-sale analytics package that, as long as you can provide pharmacy data for your customer, we will be able to do a pre-sale analysis for you that will show what are the top costing medications for the plan, which of the savings channels are we able to identify to reduce costs, as well as rebate projections, discount projections, and a total savings opportunity by leveraging EZrx. This is a transparent pass-through arrangement. So HealthEZ will be passing through the rebates to the plan sponsor if they purchase EZrx. This program is a dial on the cost containment, and it is focused primarily on lowering costs as much as possible. And our analytics based on the programs that we've compiled to reduce spend believe that this program can save an average employer up to 50% on their gross pharmacy spend. Some of the terms and conditions within the pharmacy agreement that we're able to bring, especially down market to employers of 250 employee lives and above, we're able to do annual market checks with the PBM. We're able to make sure that the PBM is being held accountable to pass through those dollars back to the plan sponsor to reduce those pharmacy costs. Some of the terms that we have in this agreement are usually reserved for super large Fortune 50 or Fortune 100 companies. Because of HealthEZ's scale, we're able to bring those down market to groups as low as 250 employee lives. So we're really excited about EZrx and the ability to really make a dent in pharmacy spend for our employers. So just to give you a little bit of a sample of what the member experience looks like in this program. So if you are familiar with patient assistance programs today or copay maximizer programs, as many of our customers and broker partners are, a member that is on a medication that can be targeted, or in this case, on a medication that is $1,000 a month or more, or $1,000 per fill or more, when that prescription is sent electronically, 99% of prescriptions are now sent electronically. The days of taking a prescription piece of paper to your pharmacy don't really exist anymore. When that prescription gets sent, the pharmacy will have a rejection that will say either this drug requires clinical review or this drug is not covered because it's a specialty medication. Please call concierge advocacy, and it'll list a 1-800 number. And our care advocacy and navigation team will work directly with the member, work directly with the physician to get whatever information is needed to do the clinical review. And while they're doing the clinical review, they will be determining which savings lever for that individual medication will result in the lowest net cost. We absolutely have the ability, if patient assistance is the lowest net cost and it is the clinically appropriate medication, to perform a bridge fill so that the member gets their medication while they go through that process. So giving them a 30-day supply while we go through the paperwork and the necessary documentation to get that medication sourced at no cost from the drug manufacturer to the plan, less a percentage of savings fill. So if you're familiar with patient assistance programs and copay max programs, this program is going to look and feel very much similar to that, but provide you with additional savings opportunities that don't exist today. Some additional things that'll be coming later this year that we're very excited about. We will be bringing its first of its kind to the independent TPA market, a fully integrated medical and pharmacy shopping experience. So for customers that purchase EZrx later this year, so in the second half of 2025, members will be able to go into the HealthEZ mobile app, or they can access it on any device of their choice. And they'll be able to actually shop for the price of medications either at different pharmacies within a default radius of their home. They'll be able to get a curated set of less expensive therapeutic equivalent medications that they can hit one button, and we will work with a pharmacist and their physician to see if it's an appropriate alternative. And lastly, we will be integrating discount cards. So you think GoodRx cash card, that when that price is less expensive than the PBM's retail price, a member will be able to hit one button and use that discount card, and whatever they pay out of pocket will automatically, without having to submit a form, get credited towards their deductible and out of pocket. And lastly, if a member does see that the price of their medication is $100 at Cub Foods here in Minnesota, and they want to transfer it to Walgreens because it's $25, they'll be able to hit one button in the Health Easy mobile app, and we'll be able to electronically transfer the prescription to the pharmacy of their choice. So bringing consumerism directly to the fingertip of Health Easy members whose employers purchase EZrx. So we're super excited about this program. This is to give you a little bit of a flavor of what the mobile app will look like later this year. You'll see on the screen that it has a My Medicine cabinet, which will show up to the last 6 months of medications that the plan or that the member has filled underneath their plan. And it will give them curated savings opportunities, whether it's transferring it to another pharmacy, seeing if they can take the therapeutic alternative, or using a discount card that is less expensive than the insurance price. So they'll be able to manage all of this directly in the Health Easy mobile app without having to go to another entity's website, delivering a transformed, unified member experience across both medical and pharmacy for our employers and members. So some of the kind of high levels on the program, and we will open it up here to questions momentarily, is this program is targeted for employers with 250 employee lives and above. If you have a traditional self-funded employer that you think this program could potentially be a fit for, please talk to your account manager or your sales rep, and we can certainly take a look at it. This program will not be available for level funded customers in 2025. This is a pass-through arrangement, so the rebates get passed through to the customer. We need 60 days lead time to implement EZrx for a customer. And our first groups that can be sold on this product will be effective dates of June 1st. So if you have a customer with a June 1st effective date or later, we would be happy to run a savings analysis for you to show you how EZrx could save your employer on their pharmacy spend. With that, I'm going to pause and stop doing the talking and see what questions we have.
So we've got a couple questions in the chat, Josh. The first one is, where Healthy is arranging stop loss, will you take the lead in confirming the stop loss carriers will cover spec claims where international RX applies? I ran into issues with Sunlight declining to cover international script sourcing, but they may have changed their stance.
Yeah, so that's a fantastic question. We have spent a lot of time on our existing international solution to make sure that that doesn't happen for employers that purchase stop loss through Health Easy. So we do have a defined process where we work with the carrier of the employer to put within that stop loss treaty, the conditions that international sourcing is reimbursable under the stop loss policy. So absolutely, that's part of our process if we are placing the stop loss. If you are a consultant that shops your own stop loss, we're happy to be part of conversations, but that is something you would want to check with the carrier that you end up placing the business with.
Thank you. The next question is, how might this affect aggregate rebates? Will Prime essentially decrease rebates across the board for other scripts to account for the reduced rebates from Humira/Stelara?
No. So this is one of the reasons that we are starting with Prime, and I did fail to mention, so I'll add this now. Our goal is to have 3 to 4 PBMs that you can choose from over the next 24 months. The first is Prime Therapeutics. That's what will be ready for June 1st, effective dates and later. But one of the reasons that we chose Prime was our ability, because we already carve out specialty for a large portion of our block of business. We were able to hold our pharmacy terms in place while bringing this product to market. So there is no impact as of today in that contract to rebate guarantees for EZrx. So we're super excited about that. It provides a tremendous value proposition, and we would love to show you how much we could save your customer based on those financial terms.
That's all the questions in the chat. Does anyone have anything else they want to ask? Josh, this has been great. Thank you so much. Very informative. I'm excited.
Yes, if you have any follow-up questions, please reach out to your sales rep or your account manager. There is a spec format of the type of information that we need, and the pre-sale analytics will literally list out the medications and which savings channel and how much we can save on the plan in total if you move or look at placing your group through EZrx.
Great.
Bye for now.
Thanks, everyone. Bye. Okay, I ended it.